Hello everyone. Today we will see about the psychological assessment and tests, their characteristics, principles, uses and interpretation. First of all, we will see about the characteristics. Here, the psychological test has several characteristics: standardization, objectivity, test norms, reliability and validity. First of all, standardization. Here, it refers to the consistency or uniformity of the conditions and procedures for administering a test. This will be done under the uniform conditions. Second one, objectivity. Objectivity in the sense, here it refers primarily to the scoring of test results. Here the scoring process will be free of subjective judgment or bias on the part of the scores. That is the objectivity. Next, test norms. Here, in order to interpret the results, a frame of reference or a point of comparison will be done to compare the performance of one person with that another person. The performance will be compared in between the two persons. That is the test norms. Reliability. Reliability in the sense, here it refers to the consistency of the person's scores. For example, here if we take into consideration a boy, if the cognitive ability test is done to that boy, if he scores 72 out of 100 and if that is repeated after a week, then the test is unreliable. Final one, validity. Here the test accuracy in measuring what it is supposed to measure, that is the validity. For example, if we want to measure some person's intelligence, the people's score on the test should strongly correlated with their grades in the school. That is the validity. Next we will see about the principles of psychological tests. First of all, the psychological test must and should have three components, that is standard. The psychological test must be standard, content and procedure. Continuous procedure must be followed. Second one, test should have the norms to allow comparison of an individual test score with that of a known group. Suppose if we are performing some test, here the one individual score must be compared with the known group. The items of high technical quality prepared by the experts, pre-tested and selected on the basis of difficulty, discriminating power and relationship. Here the test will be based on the high technical quality. It must be prepared by the experts. Procedures are standard for various test users because the directions for administrating the scores are precisely stated. A test manual and other accessory material is provided. Here what happens? The technical qualities and interpreting and using those results will be mentioned here. So the test manual will be provided. Whatever they requires, we need to provide before itself. Next, uses of psychological tests. Information. It helps us to gather the information through the test rather than from a clinical interview. For example, if we take one clinical patient and normal individual, it helps us to gather the information correctly. Second one, scientifically more consistent. Here what happens, the information gathered through the test is considered as a scientifically more consistent. Assist in diagnosis. For example, Rorschach ink blot test, it helps in identifying the person diagnosis. Assist in the formulation of psychopathology. For example, thematic apperception test, the psychopathology formulation will be done. Help in determining the nature of deficits present. Here, in case of cognitive neuropsychological assessments, the nature of deficits present in the individual we can able to identify. Help in assessing the psychopathology and response to treatment. Whatever the person is responding to the treatment, we can observe easily through the psychological tests. Help in assessing the general characteristics of the individual. We can assess easily what are the characteristics of individual and how they are performing the abilities individually. Used in forensic evaluation. in case of any family court or any litigations happens, and in case of any criminal cases issues, this psychological test will be done. Assess the level of functioning and disability. Not only this, the treatment outcome and it helps in the direct treatment. Interpretation of psychological tests. Here, in the case of persons, comprehensive behavior will be observed, not only in the physical but also mental, emotional and spiritual. All the comprehensive aspects it covers. Most of the clinicians prepare a general outline to formulate a psychological report. It includes all these things: test behavior, intellectual functioning, personality functioning, inferred diagnosis, degree of present overt disturbances, prognosis for social recovery, motivation for personality change, primary assets and weakness, and the recommendations. Through this, the clinicians can formulate a psychological report so that they can interpret in their research. What is the main role of nurse in the psychological test? Why it is important to know about this psychological test for the nurse? Role of nurse. First of all, the nurses should be familiar with the standardized psychological test. What is the psychological test going to perform on that particular patient? Nurses need to be familiar with that one. This psychological test helps in providing the care so that they can measurable indicators of treatment outcome will be identified. For example, here, if the nurse is caring for the patient with a depression, so that she can establish a profile based on the patient symptoms and confirm the diagnosis. So, during the course of the treatment, she can observe the patient's progress and she can formulate that in the psychological report. Third one, nurses need to have the knowledge about the psychological test because it will enable her to clarify the various doubts that the patient or his relative might express so many doubts, so that she can clarify that doubts. Reassurance. The nurse should reassure the patient on the safety of the tests and the confidentiality. Treatment purpose. For giving the treatment, the patient's attenders will have so many doubts regarding the disease condition. By knowing the purpose of this psychological test, she can able to explain the treatment availabilities, whatever available in the hospital, she can explain to them and she can give the better treatment. Confidentiality. She need to maintain the confidentiality for the disease condition of the patient, because whenever we develop the trust from the patient or patient attenders, then they can trust easily and they will take the treatment properly. That is the confidentiality. These are all the main role of nurse. Thank you all for listening to this video. Please like, share and comment. Thank you.